Hello, Mr. Strader. How are you doing today?
Pretty good.
Good. My name is Ashley Anderson, and I'll be your student physical therapist for the day. All right. I'd like to see how well you're doing with your manual limb drainage that we did in your last session. I believe that you're progressing very well. So with that being said, I would like to move on to something else called compression therapy. Have you heard of this before?
No.
No? Well, let me tell you about it. Basically, it's just the main concept of manual lymph drainage. We're going to focus on getting that excess lymph fluid and get it to move to the healthy lymph nodes so that it can allow for normal drainage. All right? It's also going to help with the shaping of your right extremity. It's going to help to allow for that extra swelling to go down and make it look a little bit normal like your left arm. Does that sound like something you're interested in?
Yes.
Great. All right, so in order for me to do this, I'm going to have to touch you. Is that all right?
Yes.
Alrighty. Well, before we get started, I'm going to need to ask you a few questions to make sure that you're a good candidate for this intervention. Do you have any history of cardiovascular disease?
No.
Any peripheral artery disease?
No.
Coronary artery disease?
No.
Any fractures in your arm?
No.
Recent infections? Deep vein thrombosis or blood clots?
No.
Any hypertension?
No.
All right, great. Well, it sounds like you'll be a good candidate for this intervention. Before we get started, I'm going to need to check your skin integrity and make sure that you don't have any open wounds or sores before we get started, okay? So you can give me your arm. All right, I'm going to just check all the way up, front and back. Elbow looks good, forearm looks good, and your hands between your fingers. Alrighty, everything's looking good. All right, the next thing we're going to do is I'm going to test your sensation. All right, so keep your eyes open. I'm going to touch you just like this. Did you feel that?
Yes.
Yes? All right, great. So this time I'm going to do the same thing on both arms, and I'm going to ask you to close your eyes and look away. All right, whenever you're ready.
Okay.
And I want you to say yes when you feel it, okay?
Okay.
All right.
Yes. 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 Yes.
Great, good job. Alrighty. Well, before we get started, is there any questions that you have for me?
No.
No? Alrighty. Well, let's get right to it. Okay. Okay, this is going to provide a barrier between your skin and the bandaging, okay? Okay. Alright, and as I wrap your hand in your arm and so forth, I want you to make sure that you keep verbal communication with me so that I can make sure that you're not feeling any numbness or tingling or any discomfort, okay? Okay, I'm gonna make sure I leave your nail beds open. make a fist for me? Alright, straight out. Great. Okay. Next thing we're gonna do is apply the gauze. Add your little cushion to your wrapping, make it a little bit more comfortable for you. Okay, make a fist and punch into my stomach so you can rest as I do this. Alright, go ahead and bend your elbow for me. Okay, okay. Just a little extra cushion at your elbow. Okay. I'm gonna get very close to the armpit area and then work our way back down. Alright, go ahead and bend that arm for me again. Okay, you feeling okay? Alright. So we're gonna go ahead and start with the wrapping. Okay, could you bring your thumb out for me? I'm gonna do this one more time. Okay, you can make the fist and punch me. Still feeling okay, right?
Yes.
Thank you. There you go. Keep punching me. Okay, go ahead and bend your elbow for me one more time. Right? Okay, just one more. And keep punching me. You feeling okay?
Yes.
Alright. Alright, bend. Alright. tape here, keep it in place. Alrighty, how are you feeling?
Pretty good.
Good? Alright. Alright, I want to make sure that it's not wrapped too tight. Make sure I'm not seeing any balloonness going on, because that'll mean your circulation is being cut off. Alright, and I want you to try and just bend your arm for me, just like we've been doing, and now act like you're finna eat for me. And touch your head. Great. Alright, well, with this compression wrappage, I want to make sure that you do the correct do's and don'ts of having the compression garment. Alright, so if you plan on flying somewhere for the holidays or whatever, I want to make sure you wear the garment, because being in high altitudes will allow for the lymph to come back and kind of negate the whole purpose of this. Okay, I want to make sure you protect your arm. Try not to hit it against anything, bump it against anything. Try to protect it from harm, anything that can cause it to swell again. I want to make sure you take care of your skin. You want to make sure you lotion. Don't allow it to become dry or cracked, because it can cause sores, and we don't need that, okay? And also, I want to make sure that you wash your garment, okay? I want you to wash it daily. And when you do wash it in warm water, allow it to lie flat and air dry. And you're going to need to buy these about every other month and switch them out, okay? Do you have any questions for me?
No.
No? Well, you look great, and I hope this works for you, and I want you to check in with me, okay?
Okay.
It was great working with you, Mr. Strider.
Thank you.
Thank you.